I'm Nicole Hunt. I'm a doula here in Sioux City.
And I'm Mallory Hertz. I'm a doctor of physical therapy, and I specialize in public health physical therapy. What are common things that you've heard mamas talking to you about after birth? Because you send a lot of patients to see us.
I do. I send every single client.
Like, as you should. Because
like, as they're pushing a child out or as they're getting stitches or whatever, I'm like, girl, you need some pelvic floor therapy in a couple of weeks. Like, and it's like, give yourself time to heal, chill out. Like, you're literally going to sit and feed that baby for a month and do nothing else.
And we really don't, if we can see them in the third trimester, prep them for birth, or before if there's pain issues. But if we can prep them for birth, we can give them a couple things to start thinking about in those first 6-ish weeks. We don't want to see them in pelvic PT really until they're cleared for intercourse. So once they're healed up, and we can do an internal vaginal exam and see what their muscles are doing, like, that's when we want to see them. So there is a gap in time between birth and between when we want to see them for PT.
There's a pressure for moms to bounce back. There's a pressure to lose the baby weight. There's a pressure to...
Oh, you're breastfeeding. That'll come right off.
Yeah. No. Because you're eating 1,000 more calories in a day than normal, and you're so hungry and so thirsty when you're breastfeeding. So there's like this pressure to bounce back. Like, I need to lose the weight. I need to get back and, be this hot mama. I need to be a good, happy mama, and I shouldn't feel this way. Or there's so much pressure just internally that we put on ourselves that's unrealistic. It's unrealistic to have all these spinning plates balanced.
And you're so overwhelmed with a new adjustment, a new baby, and how do you feed them and their sleep cycles, and so for us that's a barrier for people to come to PT. So we work really hard in our physical therapy sessions to not overwhelm mamas. When they come in to the initial evaluation, they tell us all the things. So we want to know their whole history. We want to get an idea of what's going on, but we're going to send them out with 1 or 2 things to work on. Let them work on it for a little while, and then come back, and then we can add another layer. So we know you already have a lot on your plate.
Right.
Moms already have a lot on their plate. So we really try hard not to overwhelm them even more.
And would you care if a mom came with a baby in a carrier?
Heck no.
No,
that's like the bonus.
Yeah.
And we get to see the babies. It's especially fun when we've seen a woman in pregnancy and then she comes back post-birth, and we get
full circle.
Yes, we get to meet the little bundle. So that's kind of the bonus. And plus, at 6 to 8 weeks, they're sleepy anyway.
Yeah.
So they're in their carrier and sleeping. I have previously had a mom like, sorry, he's hungry. I'm just gonna feed him here on the table if you don't mind. And it's not a big deal.
Who cares? No one cares.
Not
You have
a
a new
big
baby. Everyone expects that baby to eat all the time, and I think that's one of the things that I struggled with my first was like, gasp, what if she gets hungry and I'm not at home in my privacy of my own home? And it's like, who cares? Feed your baby. Like, however you're comfortable. That, like, state laws literally accommodate for moms to breastfeed in public. Yes, congratulations, everyone.
Yeah.
So I think that's something that, like, if a mom's like holding back from taking care of herself because, well, I have this child to take care of, bring them along. Mallory says so herself.
Yep. It's an extra bonus. And if they get fussy, there's always another gal in the office who, like, really wants to hold the baby.
Yeah. You're a mom. You just had a baby yourself not that long ago.
Yeah.
So, like, you told, she gets it.
Get it.
Yeah, that's like one of the nice things too. Even like with different OBs in town, it's just like, oh, they've got like little ones. They're not too far removed from this. They get it. So that's some of the nice things about
personal perspective on top of the professional side of it.
Yeah, right.